Everyone, Dr. Mandell here with you today. Interesting, even for myself, a very interesting topic about water. Now, we understand the importance of water, but what happens to our body if we stop drinking it? That's what this program is all about. I'm going to teach you the importance of water and then bring out some very important things that you were probably not really aware of. But I really think that this is going to be a great topic, an educating topic, something that I'm going to ask you to share on your social media to really reach those populations of people, to really educate them, because this is life. You know, people talk about dieting, starving themselves, which you can go a long time, but without water, you can't go more than several days. Water is one of the most important nutrients in our body because the fact that we are composed of about 60 to 65% of water. Unfortunately, many people are not really getting the amounts of water that they should be getting because they're drinking sodas and coffees and teas and not realizing that caffeine and alcohol dehydrates us. So therefore, the kidneys are excreting more fluid out of the body, and we can't afford that. It's important to understand that our body's made up of about 60 to 65% water, and there are so many important bodily functions that water is necessary in regulating temperature, cushioning joints, lubricating our eyes, sending and making hormones and changing chemicals and allowing digestion to occur. And realize that just sleeping 6 to 8 hours a night, we are losing water. We're dehydrating ourselves. So if you're not drinking water regularly, you're going to know why, because you're probably going to be one of these candidates. I'm about to share with you all these different little things that can be going on in our body that you really probably won't believe, but it's quite fascinating. So in doing my homework, I hope that my homework has paid off so you can become more educated and we can help continue to educate our world. Just a little bit about facts about this. If you can't see this, I know it's small. 75% of water is on our brain, 83% of our blood. This carries the nutrients to all our cells. It moistens the oxygen for breathing and helps carry the nutrients and oxygen to our cells. It helps convert food to energy. That's where we get our ATP, obviously. It regulates our body's temperature, removes the waste, which we'll talk about, protects the cushions of the vital organs. It cushions our joints, which we'll talk about. It composes 22% of our bones, and it makes up 75% of our muscles. Now, that's just the really fine highlights of it. I'm going to go a little deeper. I'm trying to move quick through this so this can be educating. I want to say hello to our chatters out there. We are broadcasting live via the internet right now. If you look at this right here, you're going to say, wow, many of you will fast or let's say diet to try to lose weight. But little do you know that when you become dehydrated, the body does the opposite. Now, it's kind of hard to really understand this, but what happens is the body is in a state of shock, realizing that we're losing water. It's trying to hold on to it. The brain sends certain hormones to the kidneys. The kidneys stop excreting the water, holds onto the water, and makes you feel more bloaty. So, little did you know, people may think, well, I don't want to drink anything else because I'm bloaty. Well, if you dehydrate, you will get bloaty. And if you drink more and as you urinate more, the bloatiness will go down. It's kind of like the salt game. As you eat lots of salt in your food, even though you're not adding the salt, you retain fluid. It increases blood pressure. It makes you feel bloaty, and obviously what you do, you feel bloaty and you're retaining salt, you don't drink water. Well, guess what? Water acts as a diuretic. So as you drink more water, that bloatiness goes down. So girls, even guys, if you want to look better in your jeans, drink more water because you will get that bloaty feeling from dehydration. Another very big thing that many people run to optometrists, ophthalmologists, dry eyes, lack of tears, difficulty seeing tears. If you notice that you're getting dryness in your eyes all the time, I'm telling you right now that you need to drink more water. Those optometrists, ophthalmologists will give you drops for dry eyes, but they may not tell you that you're dehydrated. Please, just that little bit of dehydration that little hydration will make all the difference for you. So that's really, really important you understand that. Now, here's another biggie. Now, I kind of like this because I can't see anything but the middle part here, but lack of focus. You may notice that your concentration is just not there. You may notice that you're not as clear and keen as you used to be. Maybe, you know, the way you're working with numbers, or maybe you're writing, or maybe when you're at work, you're just kind of a little foggy. That is a big sign of dehydration. So just knowing that you're not focused right, you don't feel right, you feel off, you may be a little kind of loopy, but just not all there, try drinking more water. It may be a miracle for you. A big one here is muscle cramping. If you are experiencing lots of muscle cramping, first thing I would say is water. Water is great. Electrolytes are excellent. Obviously, it may be certain electrolytes like sodium, sometimes even putting a banana inside your body, but just start drinking water, because water is the #1 thing to muscle cramping. We find this in athletes, people who are out in the heat, people who are working long hours and not really taking the time to hydrate. I notice many people will take their little bottles with them, but it is so important to drink that water. Now, realize that when your body feels thirsty, it's really too late. When I say too late, not that it's going to harm you or it's going to kill you, but it takes time for your brain to feed in to dehydration. So in other words, once you're dehydrated, you may not feel it right away. So the tip for today is drink before you feel thirsty. You're going to save yourself a lot of problems, and that is the healthy way to be. Now here's a big one here about brains. Realize the brain composes a lot of water. When you're not getting that type of water, your brain starts to shrink. That's right, because your brain is composed and hydrated of water, and it will affect your thought process. So if you are noticing that you are just not where you want to be, your thought process is off, you're not really being where you should be, you need to understand that water is so important, that the brain will actually shrink. The cells and the way it functions and the way it communicates and the way it produces the hormones will not be the same when your brain is dehydrated. So remember that when you're dehydrated, it's just not you, it is your brain as well. Okay, so that's important because that is all your thought processes, and that's where everything works from. Remember, there's a lot of important parts within your brain, like the anterior pituitary, that produces the melatonin and produces different hormones that affect your thyroid and affect your kidneys. And if you're not getting the proper water, you can be having thyroid conditions, even kidney urinary output, which we'll talk about in just a second. Here's a big one. Now, I like this picture, but this will give you lots of fatigueness. And I didn't really know much about this until I experienced this many years on my own from the past. I was feeling just tired all the time, you know, and I wasn't drinking enough water. If you are chronically feeling tired, do what I tell you with water first. Yes, hypoglycemia can cause this, low blood pressure can cause this, sickness can cause this, viruses can cause this, but more often than not, dehydration, just lack of water, can make you, give you that groggy, that type of tired feeling. So that's important. Headaches, another big one. If you're experiencing headaches, bump it up. When I tell you with hydration, that is a big one. Now, another big one that I want to talk about here is the old blood pressure. Now, realize that this is kind of hard to believe, but if you look at blood pressure, hypertension, high blood pressure, is common in people who are chronically dehydrated. What happens is when the body's cells lacks water, the brain sends a signal to the pituitary gland to secrete vasopressin. And vasopressin is a chemical that causes constriction of the blood vessels. And when these blood vessels constrict, you have less blood that gets through. And obviously the heart has to pump harder, increasing blood pressure and increasing hypertension. So yes, if you notice that your blood pressure is more elevated, try hydrating. You may say, wow, this is a miracle. especially if you go to a cardiologist, an internist, and he takes your blood pressure. Oh, we got to put you on blood pressure medication. Guess what? I bet that doctor never asked you about your diet, about hydration. You can go ahead and hydrate. All of a sudden, it drops 10, 15 millimeters of mercury on your systolic, or maybe 5 or 10 millimeters of mercury on your diastolic. You have normal blood pressure again. So that is something that is a big plus and something that's good to understand. Now, here is another very important one. It's about our heart output. Now, we look at the heart output, and we look at about the heart working overtime. Well, obviously, realize 60% of your body is water. And obviously, we realize that as you become dehydrated, what happens is the blood stops going to certain parts of the body. It's got to get to the survival mechanisms like the muscles. It has to. So a lot of times the face will be shut off. And that's why people may get bluish in the face or paler or like pale in the face, because we stop losing the sweating. Because remember that water affects the body temperature. It affects our sweating to keep our temperature of our body equal and balanced. But when we get dehydrated, our blood volume decreases, but your heart has to pump the same amount through your body to provide the same cooling relief and the same nutrients to working muscles. And by reducing the volume available, it makes the heart work harder. And when your heart can't keep up, guess what? You could be at greater risk of heat exhaustion and obviously a dangerous cousin of heat stroke. And that's why we find lots of people out there, particularly more in the elderly, that develop heat exhaustion or heat stroke, even people that work outside, roofers, people, landscapers, because of the fact that your brain doesn't perceive dehydration quick enough. And obviously, once you get to that lower state, your blood pressure will start to drop because you'll go into shock. You can start looking for lots of problems. Let's move on. I hope that you are enjoying this. Let's talk about dry skin. Women, more than guys, I know you're a little bit more of a fanatic when it comes to skin. Even though, guys, we really need to take care of our skin too. But if you are noticing dry skin, not only in your face, but other parts of your body, your arms, your legs, you are usually dehydrated. Now, me putting my hand on thousands of people over the years in the work that I do as a chiropractor, I can feel the skin. I can go to tell my patients, I say, you haven't been drinking enough. How did you know? I can feel the texture of the skin. You just start to know. I can tell you that about 40% that I've seen out of thousands of people over the years are dehydrated. They're just not drinking enough. They're just not having its symptoms. But if you noticed that maybe you're not urinating enough, or maybe your output is diminished or decreased, yes, you are dehydrated, not getting enough. And guess what? Your kidneys needs water. Just like your kidneys, your blood, your organs, your tissues, and everything else. Now, we talk about depleted urine output. If you notice that the urine is real yellow, and it usually is in the morning, okay, because you're dehydrated. So as the day goes on, if you notice that it's still very yellow, it means you're still dehydrated. That is a great indication to start drinking more water. Now, a little tip, if you are taking lots of B's and C vitamins, it will make your urine very dark. And that can kind of give you the misunderstanding that you really are not dehydrated. But look at the urine. That is really important. Now, here's another chart that gives you a little bit of a chart about hydration, dehydration, about your urine color. If it's real pale throughout the day, that's good. You're hydrated. You can see as it gets darker and darker, basically it says health risk. It means really drink more water. So that a good indication is our urine, because our urine is kind of talking to us with no words, just by color. So I want you to observe the urine a little bit better. I think it would be wise for you. Now, here's something. I'm sorry to show you this, but I have to show you this. This is all about constipation. I know it's not a real pleasant picture here, but the number one reason, and I'll get away from this picture so you don't have to look at it anymore. The number one reason for constipation is dehydration. That I'm telling you that if you are having fecal material in your intestines and it's sitting in your intestines, you're going to get intoxication. And that auto-intoxication basically means you're getting rotting. You're getting bacteria that's sitting in your intestines, that's rotting, that's getting into your bloodstream, and that is causing sickness, and that is causing disease, and that can eventually lead to precancerous problems. It can lead to polyps. It can lead to other conditions because our transit time becomes significantly diminished within the intestines. And that's why people talk about the importance of a quick transit time, that you go regular every day. Some people 2 times a day, some people 3 times a day. But if you are noticing you're not going to the bathroom every couple of days, you better start drinking water. And you know what? Add a little olive oil. Take a little tablespoon of olive oil. Take more omega-3 fatty acids. Put the oils back in your system. Don't be afraid about that fat. It will make you feel better. It will make you function better, and it will really make a big difference for you. So hopefully that will really make a big change with you. So the next one I want to talk about is about the water. Now, water increases metabolism. And I noticed that more females and males want to find little tricks on how to increase my metabolism to lose weight. Studies show, and it's out there, all in the literature. You can go through it and you can research it. It's out there, I promise you. If you drink a cup and a half, an hour and a half, 2 hours before you eat, not only does it fill you up, but it increases metabolism. Remember, digestion entails fluids. Water is involved in about everything that goes on within the body. Water will increase metabolism, and it will help you burn calories and help you obviously expel those toxins out of your system, not only through the urine, not only through the rectum, but through the skin. That's important because the skin is our largest organ, and that will help get rid of a lot of those toxins. Now, people are asking the amount of water intake. Very simple. I've done videos on this, and I've got a lot of comments. Cons and pros. Well, how do you know how much water? Well, I'm going to give you a guideline, the 8-8 principle. The 8-8 principle is 8 ounces, 8 cups a day. Now, you're saying, how do I know that's enough, or how do I know if that's too much? That's just a general rule. Now, if you spend more time outside and you're spending time and you're sweating, you're working out in the sun, you're perspiring, or you're an athlete, or you're doing more vigorous work. Someone just mentioned alkaline water. If you're doing more vigorous work, you're going to sweat more. So you're going to obviously need to take more water. Now, it depends upon your age, depends upon your gender, a little bit of genetics. There's a lot of different things, but overall, if you are 200 pounds, half the amount in ounces. If you're 160 pounds, half the amount, which is 80 ounces. That's just a general rule. All right. I don't want to say that everyone follows this rule. So what's really recognized out there is the 8-8 principle, the 8 ounces, 8 cups minimal. Okay, I think that is a general standard. Now, if you look here, water in the human body, as we talk about other things, it forms our saliva. It helps keep the mucous membranes nice and working the way they should. It allows cells to grow and reproduce and survive. It flushes the body waste, as we talked about. It lubricates the joints, and I want to talk about that for a second. There are people out there who have disc conditions, who have joint problems. Now, you look at the synovial fluid in the joints. The synovial fluid is what allows the joints to glide. The discs are filled with fluid, the majority being water. Okay, so if we're dehydrating ourselves, we're dehydrating the disc, and obviously we're setting up a situation where, hey, you know what? I've got herniated disc, got bulging disc, I've got problems in here. I'm running to doctors, I'm taking anti-inflammatories, I'm getting cortisone injections, I'm doing epidurals, but I'm not drinking enough water. That's like putting water in your tank, in your vehicle, and expecting it to run. How can your body operate? How can your body work to its maximum potential if you're not giving it what it needs? So I'm telling you right now, one of the best things that you can do for all my listeners right now, or listeners that will listen to this program, is start drinking more water if you're in pain. Increasing water helps the body decrease pain. Fact. All right? Not many people talk about that, but it's out there in the literature. If you increase water, you're going to help the body decrease pain, because ideally the brain's going to function better. The brain is going to be able to work and communicate better within the nervous system. And it's very complex. The nervous system is very complex, but you're going to function and work better because your body's going to function easier, less stress. Okay? It's a major component of all the body moving parts. We talk about the hormones, the neurotransmitters. body temperature, the shock absorbing. Now we talk about shock absorbing. Look at the discs. If you're running and you're jumping and you're moving around and you're walking and you got pounding on there, or even if you have more weight, you need that water because that helps as a shock absorber. The discs keep the vertebrae apart, okay? They keep the vertebrae apart, but this keeps the opening where the nerve is. But if you're moving and you're bending, you need that cushion in there. Because when you lack that cushion, you lack that support. And obviously you don't want bones rubbing together because it's going to cause pain. So for nutrition, for oxygen, for everything else, water, water, water. Now I hope that this gives you a little insight, because I know what a lot of you are going to start doing. You're going to start drinking water. I know you are. And sometimes we need to open that door and say, hey, you know what? I can see the light on the other side of the tunnel. I realize that I've been suffering with these pain problems. I'm having this chronic fatigue. I notice my digestion is bad. I notice I've been having constipation. Those are the things that water will do to you and everyone else, just not you, if you're not drinking water. So I urge everyone out there, please, and I say this from my heart, because if you really want to stay well, you need to do things the right way that your body needs it. You know, listen, we're just human beings, okay? We're just trying to survive. You know, people in the chat rooms, people with emails, we're asking questions, including myself. We all have our issues. We all have our obstacles in life. We're trying to find answers. But we need to give the right fuel to our bodies and do the right things, because medicine is not about nutrition. Medicine is there for certain reasons. It saves lives. Surgery saves lives. Medications help save lives. But we need to be proactive. We don't want to get to the point to where things break down, because, you know, I say this to all my listeners out there, and just if you are new and just listening, you know, we can wear out our vehicle, we can change the parts, our refrigerator, our freezer, our dryer, we can wear out our teeth, we can get substitutes, but if we wear out our body, where are we going to live? And that's what it's all about. It's preserving our body, preserving our health, and keeping ourselves healthy for our loved ones, our family, and for our friends. Anyways, I hope you enjoyed this program. I really would hope that you share this in your social media. Check out and give me a big like here, as well as Facebook, Motivational Doc. I really thank our chatters for being here. I thank everyone. I really hope that this helps you. I try to do it the best I can, as quick as I can. I know these programs go a little long, but I can't cheat the truth. The truth is, this is your health, and when you put the dividends in there, you're gonna get the profits later. Take care. God bless everyone. We'll be with you real soon. Bye-bye now.